Good afternoon, everyone, and welcome to today's Town Hall. First and foremost, I'd like to welcome our staff, students, and faculty that have joined us today, and also in particular, our board members who have chosen to participate in today's Town Hall discussion. My name is Pablo Ortiz, and I have the privilege of serving as the Vice President of Regional and World Locations and Vice Provost of the Biscayne Bay campus. What you just saw were some of the activities that have taken place here on your very own FIU campus. From vaccinations to student events, these are all designed to help keep everyone engaged and in particular to keep everyone safe as we kick off our spring semester. A lot has happened thus far in 2021. Among the most notable, of course, is the rollout and administration of the COVID-19 vaccination. Today's town hall is very timely and important as we will hear very important information and updates from some of FIU's top experts. They will be discussing the COVID-19 vaccine, what to expect in the coming months, and how you can be part of the solution. Before we begin, I'd like to take a moment and recognize our president, Dr. Mark B. Rosenberg, for his leadership, vision, and guidance during these very uncertain times. Thank you, Mr. President. As I mentioned, today we are here to listen to and answer your questions while hopefully addressing many of your concerns. We encourage you to share your thoughts and questions while using the Q&A function in the Zoom call today. Please make sure your questions are succinct as possible so that we can get them all answered in the time allotted that we have. We do only have an hour with you here today. In addition, today's discussion is being live streamed on FIU's Facebook page and will also be recorded and available later on news.fiu.edu. And now it is my pleasure to introduce and welcome our provost, Dr. Kenneth G. Furton.
Thank you, Pablo, and good afternoon, everyone. I'm so excited to see so many of you joining us for this very important conversation about the COVID-19 vaccine, as well as the continuation of our mitigation strategies that will be discussed by some of our experts here at FIU. As you know, at FIU, the health and well-being of our entire Panther family is a top goal for us, as well as ensuring that our students can achieve their dreams of completing their degrees and gaining employment. Since the spring of 2020, we've done everything in our power to ensure that our campuses are safe and to try to address all of the concerns that have been raised in previous town halls. So we're looking forward to the discussion that occurs here today. Whether it's through our Panthers Protecting Panthers app and plan, our community partnerships for testing, contact tracing efforts, and now vaccinations, we're working very hard to protect our Panther community and our surrounding community. And while the county and the state positivity rates are on the rise, the positivity rate on our campus remains significantly lower than the community. Typically, we've been below 5%, and some oftentimes significantly below that. Also, on December 11th, you may have seen in the New York Times, they published an article on COVID-19 cases, and there were many universities with over 1,000 cases as of that date. And I'm happy to say that including all the Research One universities except FIU, we had less than 1,000. In fact, we only had 304 cases at that point. This semester, we've actually stepped up our surveillance screening on campus, including we're doing more frequent mandatory testing of our housing residents, our lab researchers, and the P3 app participants. We're also continuing with all of our very strict cleansing protocols and our information campaign to get everybody aware of the fact that we're continuing with face coverings, physical distancing, and hand washing. And we have a COVID response team that responds quickly and follows up personally with all individuals that have COVID-19 or could have possibly been exposed. And now as the vaccinations become more available in our community and here at our own FIU, we have this opportunity to update you on some of the efforts that are going on. It's important to note, however, that there are many unknowns, and we'll have regular updates for you as we gain more clarity through working through this process with intentionality. Again, it'll be based on science as well as guidance from our local, state, and federal agencies, as well as our health partners. We have successfully partnered with Baptist Health and Jackson Health to provide vaccines, COVID-19 vaccines, to hundreds of our FIU community members that are age 65 and older, in accordance with Governor Ron DeSantis's executive order. And just this week, thanks to Miami-Dade County Mayor Daniela Levine Cava and the Florida Department of Health, we've now launched our own vaccine program at FIU, which you'll hear more about. We are able to provide the vaccine to the individuals who are 65 and older, and FIU healthcare faculty and staff that have a direct patient contact. And today you'll learn from our speakers a lot of details about vaccines availability and how we're going to continue to work together for a smooth process as the vaccine rolls out in the coming weeks and really months. There are, as I understand it, 63 vaccines in clinical development. So there's a lot of excitement that as more vaccines are available, we may be able to accelerate this process. But I want to emphasize that although vaccines will be increasingly available, this does not mean that our health mitigation efforts are suspended. We can see light at the end of the tunnel, but it's a very long tunnel. And we expect that throughout this entire semester, spring semester, and likely into the summer semester, we're still going to be required, everyone, including myself, to do the P3 app before we come on campus, wear our face coverings at all time on campus, physical distance, get tested regularly. That will continue. So I want to emphasize that. And that is Panthers protecting Panthers. So I hope you find today's town hall informative, and please ask questions or express your concerns. As I've said, we have learned a lot from these town halls, and we're really looking forward to having a conversation and trying to answer your questions either online or live. And we look forward to a great conversation. Thank you.
Thank you, Mr. Provost, for your message and for your reminders and in terms of ensuring that we all do our part to keep everyone safe. And with that, you also mentioned the expert panelists that we have with us here today, and it is my pleasure to introduce them to you. They have some very important information to share, and they will be on the call here, on the Zoom call, to answer any specific questions that we can live as part of today's meeting. So first, let me begin by introducing Dr. Mary Jo Trepka. She's the professor and chair of Department of Epidemiology. Dr. Carlos Espinal, interim chair, Department of Health Policy and Management, Director of the Global Health Consortium, and also Dr. Aneta Roldan, the CEO of the FIU Healthcare Network. So with that, we'll get started with Dr. Mary Jo Trepka.
Good afternoon, everybody. Thank you so much for joining us. I'm so excited that there's so many people interested in learning more about the COVID-19 vaccine. May I have the next slide, please? So I want to tell you a little bit about what the COVID-19 vaccines are. So essentially, they're a medicine that help train our immune system so that we can fight the coronavirus. Both of the vaccines that are currently authorized in the US work by exposing our body to part of the coronavirus protein. This in turn stimulates the immune system to create antibodies and memory cells. And these in turn are ready in case our body is exposed to the actual coronavirus. Next slide, please. So we have two vaccines that are currently available to us. And I have to say, we are so very fortunate because we have two highly effective vaccines that showed in the clinical trials, we found that they were highly effective as well as safe. And not even for people in general, but even elderly people, which is unusual. So both of them require 2 doses. The Pfizer vaccine, you have to have at least 3 weeks between the 2 doses. The Moderna vaccine, 4 weeks. What's very important is that you have to get your 2 doses from the same vaccine. You can't have a dose of Pfizer and a dose of Moderna. You have to stick with the same vaccine. The Pfizer vaccine is authorized for people 16 and older, the Moderna vaccine for people 18 and older. Now, there are ongoing clinical trials to determine if these vaccines are also safe and effective for children, but they cannot be administered to children until we know that, and they're authorized for that use. Now, these vaccines commonly cause pain, redness, and swelling at the vaccination site and flu-like symptoms. These are temporary effects, and these are really just reactions to our body's immune system working. It's kind of like if you were working out, running, bicycling, or lifting weights, and then the following day you feel sore. Your immune system's being trained. So you should think about it that way. Now, what we worry about are serious adverse effects. In the clinical trials, there were no serious adverse effects that were seen more frequently among the people who are vaccinated compared to the control group. But clinical trials are only with tens of thousands of people. Now we are vaccinating millions of people, and it is possible that rare adverse effects will occur. And the CDC has a surveillance system that's monitoring that. And in fact, last week they produced a report on some initial information from the Pfizer vaccine of about 11 cases of allergic reactions per 1 million people vaccinated. And for that reason, when people are vaccinated, you have to sit for 15 minutes and be monitored before you leave. And people who have a history of anaphylaxis or like a reaction, say, for example, to peanuts or any kind of allergen, you do need to sit for at least 30 minutes. Now, there is a third vaccine that I think that we're going to be seeing very shortly, the Johnson & Johnson vaccine. There's been a lot of news about that lately, but the phase 3 trials, they're not finished yet. It has not yet been authorized by the FDA, so we have to wait. The good news about that, though, is that we have another source of vaccine. And the second thing is that it can be administered as 1 dose. Can I have the next slide, please? So I spoke about how these vaccines are very good at preventing clinical illness. So that will protect us as individuals. Now I want to talk about how vaccines protect our communities. Now, there's 2 ways to get immunity. One way is that you get infected with the coronavirus, and the other is that you get the vaccine. Now, if you get infected with the coronavirus, you will get immunity. We don't know how long it will last, but you'll get some immunity. But of course, the problem is that you get clinically ill, and in fact, you might get seriously ill, and also that you are very infectious and that you can infect other people. And that's what this pandemic has been about. Now, the beauty with vaccines is that you get that same immunity without the price of becoming clinically ill, and generally speaking with vaccines, without being infectious. And that leads to the concept of herd immunity that I want to talk about. But first, I need to point out that in the clinical trials, what was assessed was people becoming clinically ill, and not if they're infectious or not. So we don't have the data yet to say with certainty that if you are vaccinated with the coronavirus vaccine, that you cannot infect other people if you're exposed to the coronavirus. So for that reason, people who are vaccinated need to continue to wear masks and do the same physical distancing. And you may wonder, well, why is that? Well, you could be exposed to the virus and it gets in your nose, and that the virus multiplies a little bit before your whole immune system starts to kick in. So may I have the next slide, please? Despite that, based on our experience with vaccines and what we know about the coronavirus and vaccines in general, we strongly suspect that most people who are vaccinated will not be infectious, or if they are infectious, it would be for a very brief period of time and to a very minimal degree. So we do believe that the vaccine is going to contribute to our herd immunity. I want to explain what that is with this diagram here. So the red dot here in this diagram represents people who are sick, a person who's sick, and then the blue dot are people who are not vaccinated or not immune, so they're susceptible to the virus. And then you'll shortly see some dark blue dots, and those are people who are vaccinated or immune, and so they are not susceptible. So may I have the next slide, please? So if nobody's vaccinated, then a disease can spread very quickly because a sick person is in contact with a lot of people who are susceptible. If some people are vaccinated, then the disease will still spread because a sick person will be in contact with some susceptible people, but it'll be a little bit slower. But if most people get vaccinated, that is, we have herd immunity, then the disease cannot spread because a sick person does not come in contact with susceptible people. And that is our goal. Unfortunately, right now, we're just at the beginning of our vaccination campaign as a country. We've just started in Miami-Dade County right now. Only about 10% of people who are 65 and older have received at least one dose of the vaccine. That means 9 out of 10 elderly people in Miami-Dade County have not yet been vaccinated. So we have many, many susceptible people in our community. Everybody still needs to do the wearing the mask, staying home when you don't feel well, the hand washing, and the physical distancing to help protect our families, our FIU community, and the South Florida community in general. And I would like to thank the RCMI, the Research Center for Minority Institutions, colleagues who helped me with this presentation. And I also would like to thank each and every one of you for your interest in educating yourself about the COVID-19 vaccines and your commitment to help us control this pandemic. Thank you.
Well, thank you very much for the invitation to speak about the COVID-19 in globally and at the regional and local level. I will be concentrating my talk on the COVID-19 vaccination and implementation program, from vaccine development to implementation. And what is important for us is to understand why do we need right now a very solid and robust vaccination program. And just the figures that we are going to see briefly will show us the relevance of what we are trying to do in really implementing this massive vaccination program as rapidly as we can. Globally, we have up to date 92 million cases and 1.9 million deaths, and with a tremendous increase in the figures in the last 14 days observation period of 28% for both indicators. The virus is really spreading all over the world, with really important impact in the economic and the social structures and on the health service, and of course in the population. Next. In the US, we see as well that we are in the critical situation today, 23 million cases and deaths, 384,000 deaths, 20 million cases and 348,000 deaths, with an increases in the last observational period of 34%, 45%, and today 130,000 people hospitalized with severe coronavirus disease. You see the trend and the figures in the new reported cases by daily. We had a record 2 days ago of 4,400 cases, deaths, and the hospitalization is also increasing. And you see the red map today all over the United States with a very high incidence and mortality and hospitalization. Next, please. And in Florida, we see the difference. The situation is not different. We have today 1.5 million cases, 23,000 deaths, and 7,720 hospitalized patients, with a tremendous and important increase in the 14-day period, observational period of 61%, 59%, and 29%. So, and the figures just speak by themselves in terms of the increase in the hospitalizations, in the daily mortality, and and even in the testing. Although there is a discussion today if testing is sufficient or not. And in the map, you see also the situation with most of the counties, with Miami-Dade, of course, being one of the highest incidence and mortality rates up to date. Next. So with this panorama, we come to the relevance of the rapid implementation of the vaccination program. We have to keep in mind that we need to reach or to achieve 70 to 75% of vaccination coverage globally and each one of the countries in order to really be able to achieve or reach the herd immunity that we all have been discussing during those days, in order to really control the negative impact of COVID-19 in the community. So in this slide, you see that worldwide, we have 29 million people that has been receiving at least one dose of the vaccine. And the top five in absolute numbers are China with 10 million, United States with 10 million roughly today, United Kingdom, Israel, and United Emirates with 1.39 million doses. But in the next slide, what we see is more relevant than absolute numbers, and is the proportion of the population that has received at least one dose. Next slide, please. And here you see that Israel has been able to cover at least 21% of its population with one dose. United Emirates at least 11%. Bahrain, that is a small island in Middle East, 5%. United Kingdom, 3%. United States, 2%. So we still have a long way to go to reach this 75% that we all need to achieve the herd immunity that is provided by the vaccination program. You see all the rest of the countries with very, very low rate, and countries like France and Italy, Spain, and Germany with very low rates of vaccination per in the population. Next. And coming to US, we have up to date 29 million doses distributed, and 10 million people at least that have received one dose. And we still have a long way to go, as we said. We see in the map the equal or unequal, not only distribution, but capacity to really implement the program. In Florida, as mentioned before, we have almost 700,000 people that have received one dose, which is about 3.2 per 100,000 population. Next. And what is very relevant today is the vaccination challenges that we face with the COVID-19 vaccination program. First, there is a low public vaccine confidence, especially in young population. There is a lack of a strong advocacy plan and communication plan to increase the vaccine trust and promote the real value of the COVID-19 vaccination. That is something very important. We didn't have that plan in the beginning, and it's not too late. We need really to develop this communication strategy to increase the low vaccination trust that we have today. So the programs, not only in the States, but everywhere, started with insufficient infrastructure, storage capacity, and solid distribution flow. The vaccine costs for the middle and low income countries will be impacting national budgets, and that is also a potential cause for the delays in the initiation of the starting of the immunization program and reaching the 75% vaccination coverage that we all need. And with this, there is a risk of inequity and disparities in vaccine access globally as well. This is why PAHO and WHO, the World Health Organization and the Pan American Health Organization, are really trying to consolidate the purchasing of vaccines to have an equal distribution and access to all the countries. And one very important challenge today is the new variants of the SARS-CoV-2 virus. At present time, we have some of the variants that are most common today: the UK variant, the Nigerian variant, the South African variant, and for sure we will have more and more of these variants as the virus continue to be present in our community. This is important. Up to date, unfortunately, we have the potential that those variants will really escape the strong neutralizing antibodies that are produced by the vaccine. So this is why it's so important to monitor by the genomic epidemiology all these variants and keep on testing against the neutralizing antibodies obtained from immunized people. So thank you very much, and we wait for your questions and comments.
Good afternoon. Good afternoon, everyone. If you hear a little bit of noise, I am here actually presenting from our vaccination site from FIU at PG6. We're very, very fortunate, very happy, and very honored that we have been able to, through the goodwill of Miami-Dade County, as well as Mayor Levine Cava, to have been able to offer 2,000 vaccines to our closed pod meaning to our FIU family, and those individuals that comply with the governor's executive order. And as Provost Furton alluded to earlier in the presentation, we are now focused into being able to cover our employees 65 and over, and those healthcare individuals, employees that are considered patient-facing patient-facing positions. So as you look at this first slide, it is remarkable to see the great effort that FIU, your FIU, and your leadership at FIU have been doing since we, in the first place, we saw this, this new enemy, and it is an enemy. It has taken lives, it has broken many families, and we continue to battle. We have actually come full circle from the prevention to the screening, to the diagnostic, to the therapeutics, and now to the immunity, which is the vaccine that you have heard. As far as the prevention, very early on, FIU took on the role of knowing how best to safeguard and to prevent transmission on its campus. We also provided screening, which I'm gonna expand a bit about. And we also, of course, had offered expanded testing, both on campus as well as in our clinics, our student clinics, our community clinics, as well as through the efforts of the Tamiami test site in collaboration with Miami-Dade County, which up to date, we have actually administered over 240,000 tests. So it is through the great efforts of FIU and the way and how much they care for this community that we have been able to come full circle. Today, we will not expand on therapeutics. That is another area that has been very much focused, both on the outpatient side as well as in the early onset of the disease, as well as on the inpatient side. And now, of course, we come full circle with the vaccines. Next slide, please. Next slide. Yes. As we look at what are the tools that we now have in our toolbox, there's different things that we need to make sure that we follow in order to reduce transmission and stay healthy during this COVID-19 pandemic. First and foremost, all the preventions that we know we can control: wearing a face mask, doing it correctly. It is not as easy to say I wore a face mask. I always say that sometimes the chin sees more of the face mask than what the nose and the mouth should be doing. So we have to have it completely covered. Washing our hands consistently, or using the hand sanitizer that we have throughout the campus. Practicing the social distancing, the 6 feet apart, knowing that if you're in an enclosed area to make sure that you are wearing those masks, washing your hands, and also the timing that you have an exposure in an enclosed area. And if you're sick, please stay home. And this is why we have the P3 app, which is our screening. We have the capability to screen through the different questions with evidence-based criteria of what is happening and why you should be staying home. And we have a COVID response team that it is readily available to help you if your P3 actually goes not well beyond the green light. Very important, the cleaning of surfaces. And very, very important is also staying abreast of and educating yourself of what are the measures and what is going on with this pandemic. I am here to say this virus is not going anywhere. This virus is here to stay. It is how we react that we are going to win the battle. So where are we with preventions? Again, all the measures that we know, all the measures that we can control. The screening, we have our P3 app. We are telling you that every day prior to your arrival on campus each day, please make sure that you fill up your P3. One of the things is do it as a behavior. It is part of your daily routine. As you park your car, wear your mask, do your P3, and go on your way. And make sure you're following all the measures that you should be following, not only to protect yourself, but to protect others and keeping our campus safe. We also have a course. I think education is very, very important. There's been a lot of education and communication throughout the campus. Please make sure that you take advantage of that. Don't read hearsay, read evidence-based material. And then of course, surveillance. With the active testing, we need to continue to know and identify what are the areas or the potential areas that can actually expose us and impact us with the transmission of the virus. Next slide, please. The diagnostic testing available. If we all recall, when we started facing this new foe, we had a lot of challenges of how best to diagnose those individuals to be able to identify them early on. Right now, we have a lot of capabilities and offerings that we can now test, and we can test many times. It is known that the more we test, the better we will be in identifying early on the potential of a virus. There's different tests. There is the viral test, which is basically identifying current disease. And then there's the antibody test, which is identifying past infection. Of those tests, they're split into the molecular. You all know about the RT-PCR. The RT-PCR could either be a nasopharyngeal swab, not the most pleasant. However, it is the best test. There is the nasal swab or mid-nares, and there's the sputum and saliva test. Right now, there's commercially available home test, and we also have, we can actually send those tests through the commercial lab. And of course, now on campus, we have our own auxiliary lab that the turnaround time is same day. We have the antigen test, that is the rapid test. The rapid test, it is in minutes, it is a point of care test. You can actually have that test done in clinics and in offices, and in a very short time, it will be also a home test. However, all these tests, they have pros and cons. It is extremely important timing of when you take the test. It is extremely important acquisition of the specimen type, and it's extremely important even the handling of the test. And therefore, all these tests, they do have false positives and false negatives. We have the antibody test. The antibody could also be rapid, but mostly this is a blood test that is sent to the commercial lab, and the turnaround time is anywhere between 1 to 2 days. So what does it mean if we get a positive test? And what does it mean if we get a negative test? If we get a positive test, that means at that moment in time, you may be infected with the virus. That's the easiest way of knowing. However, we do have false positive. Again, depending on the type of test and depending on the timing of the course of the virus. And what does a negative test mean? It means that you may not have the virus. However, there are false negatives. So therefore, we have to follow what's called a symptom strategy. We know that we have asymptomatic individuals that have tested because we have tests readily available and that they have turned out to be positive. That has been the challenge since we have known that that these asymptomatic individuals, it is a way of transmitting the virus because they do not feel sick. Again, I reiterate, even with asymptomatic positive individuals in our community, if we follow our preventive measures of wearing a mask, which is our best defense, we will reduce and mitigate the potential of transmitting the virus. Next slide, please. And finally, we come full circle with the vaccines. Currently, as Dr. Trepka just mentioned, we do have 2 vaccines. They're different in the sense of when you take the first or the second dose. It is extremely important that if you do decide to take the first dose, you have to take that second dose. We know that with the first dose, you have approximately about 52% coverage of immunity. That is not what we want. We want the total efficacy of the different, of whether it's Pfizer or Moderna, 95%, 94% respectively, in order to reach that herd immunity that you heard about with Dr. Trepka as well as Dr. Espinal. We know that the vaccines, have you heard, offer natural protection, immunity. We also acquire immunity by having the virus. But we also know that that specific immunity could last maybe only 90 days up to 120 days. However, there was good news. We now, very early studies have shown that the immunity with the vaccine could last up to 8 months. We hope that we could see an immunity of a year. So whereas this particular vaccine, together with your flu vaccine, could be an annual event. So who gets vaccinated currently? We follow state law, which means the governor's executive order. The current executive order says that number 1 is the long-term care. Number 2 is individuals 65 and over. And number 3 are healthcare personnel or patient-facing individuals. These are the individuals that have been deemed with the highest potential of potentially being infected and exposed to the COVID infection. The best protection against COVID-19 is both vaccination, which is immunity, and to continue to follow the CDC preventive measures. Yes, you get your vaccine, you get your first dose, you get your second dose, and as Dr. Trepka had mentioned, you will be much better out in the community. However, that does not give you a license to take away not to follow the other measures. So it is extremely important that we continue to follow the face covering, the hand washing, and the social distancing until such time that we can reach the herd immunity. So the best approach to combat the virus is to use all the current tools. We have come full circle. We have to use all the current tools available to prevent the disease, the spread of the virus. And how do we help ourselves to help others and help our family? Is staying healthy. Staying healthy also means that hopefully you got your flu shot. Hopefully you're following a healthy diet. You're going out, you're walking, you're getting some sun, you're following all the healthy things that we know we should follow. However, some of us don't. And having healthy habits and healthy behavior. And by the way, healthy behavior in a COVID pandemic means that we have to follow all these rules. It is the only way that we can get ahead of the virus and not the virus get ahead of us. So I want to thank you. And like I said, I also at this moment, I also want to thank all my colleagues, peers, everyone that is listening to us today, because I am very proud to be here and to be able to say that FIU has reached that final, like Provost Furton said, we are seeing the light at the end of the tunnel. It might be long, but we will reach it. So thank you very much. And I look forward to your questions.
Great, then let me join you, Dr. Roldan, and thanking all of our panelists for just a great amount of information. I'm sure you've answered a lot of questions already based on your short presentations, but as we promised, we're going to jump right into the Q&A and begin the process of answering as many questions as possible. That's the goal today. It's to really try to answer those questions in a number of ways. First, I will be asking some of the panelists the questions here live on the Zoom meeting, and you'll get to hear them live, both either as a participant of Zoom or if you're watching on Facebook Live. We also will be answering a lot of questions. We have a team that's behind the scenes here that will be answering a lot of the questions that we can't get to live here on screen in the Q&A chat function, right? In the Q&A function, you will be getting those answers and you'll be able to read those. So I encourage those that are participating via Zoom to keep an eye on both, on the Q&A function as well as the screen, so that you can get the answers to your questions. And finally, some of you on the Facebook Live might have questions or have submitted questions. The questions that we're answering on the Q&A function that you may not be able to see now, we will be capturing all of those questions and answers, and we will be publishing those following today's Zoom meeting so that you can read through those on our coronavirus webpage through the resources that we make available there. So a lot of ways that we hope to give you the answers to those questions. Now, I'm going to begin with the Provost. The first question, Provost, goes to you. As we all know, we've kicked off our spring semester, and that brought about as well an increase in the number of face-to-face and hybrid courses here on campus. And the question is, if in consideration for vaccine being given, is there a consideration for vaccine being given to instructors of these in-person and hybrid classes?
Yes, so we are following the guidelines as from the executive order of the governor, and focusing on 65 and older, or faculty who are patient-facing in sort of frontline workers. But we are also expediting, the faculty who are teaching in person are being given a priority within that 65 and older. And so already the latest count as of today, I believe, is 162 faculty have received their vaccination.
Great, thank you, Mr. Provost. And I just want to continue on this topic of the faculty, and this is a question for Dr. Roldan. How often, if I am a faculty member that is now teaching a course, either in person or hybrid, how often would you recommend that as a faculty member, I go in and get tested for COVID-19?
The more, the better. So if you're here 5 days a week and you want to get tested 3 days, three times a week, that can be done. We normally, like I said, right now we're looking at, what is it? It could be less sensitive, but rather more frequent testing. So because we have testing on campus, and we can either have the walk-up test site or we have the clinic, I would say 2 to 3 times a week. If you're here 5 days a week, that would be fine. Unless, and I could also ask Dr. Trepka, what would she say? Because we have had that conversation. But the more frequent testing, the better it would be, that we can identify the potential transmission of virus.
Dr. Trepka, do you have anything to add to that?
No, I think we have plenty of testing available on campus, and if you want to get tested more frequently, I think there's no harm to that, and that's a wise thing to do.
So what I'm hearing, there are no limits, and there are testing sites available. We have them at MMC, but I also want to point out there is a testing site available at BBC as well. We do have a curative trailer there. So should you live closer to BBC or want to access that one, again, those are all available to our faculty and staff and students, and of course the community. So take advantage of that as much as you can. So the provost in his opening remarks mentioned that there are still a lot of unknowns, and I can see now in the Q&A, and we've received a lot of feedback on this particular issue, is the one question I think that many of us are asking, and that is, what does the order look like, and what does the timeline of the order look like? And I'm going to just make that question very simple, and it's to any one of you on the panel that would like to answer. When is it my turn? I know that Dr. Roldan, you talked about the 3 priority groups that have been laid out by the governor's office, but when is it the turn of others in different age groups, or students, or others that may be very, very interested in getting in line for these vaccines?
Provost Burton, you want to start, or Dr. and then I can follow?
Let's start with Dr. Trepka.
Okay, so the decisions about who gets the vaccine are being made at the federal level and also at the state level. So this is not a local decision, it's not an FIU decision. So we have to wait to see what is decided at those levels. Now, the fundamental problem is that the supply is not large enough to meet the demand. Hopefully there'll be more vaccine that will be produced soon so that we will see a greater supply. And as that happens, then the vaccine will be available to other groups. I understand everybody's frustrations. I share the frustration as well. At this point, we need to, in my opinion, really focus on getting those elderly members of our community vaccinated, because they literally are hundreds of times more likely to die of COVID-19 than young people are. The vaccine will come to all of us eventually. And I think what is really, we should feel fortunate that we have 2 vaccines with such a high efficacy, number one, and that we live in a country that has made the decision that this is a high priority. And if you want, what can you do now? Right now, what you can do is to help to prevent further transmission of COVID-19. You can also reach out to your public officials and say that you would like more resources put into the manufacturing and distribution of the vaccine, because we need to make this a high priority if we're going to get our country back on its feet again.
I would like to add, if I may, Vice Provost Ortiz, I think that things may be looking brighter as we also have J&J coming down the pipeline that hopefully we can get an EUA approval. We feel sometime early February, that's what it says. We also have AstraZeneca, as you know, that's another one that may be coming down. So we hope that sometime in the spring, that's what we're looking at, that it would be a lot more expensive. But then again, I do agree with Dr. Trepka. There's a lot of variables in the decision-making process. And obviously we also have the challenges of the supply chain that we have to contend to. So again, I just want to let everyone know that the vaccine is now the all in all, okay? That is absolutely a very good step in the right direction, but we have the measures in our control, which is all the measures that we know.
So with the assumption, and I guess I'll go back to both of you on this, with the assumption that the supply will hopefully continue to increase, and we get to a point now where the majority of the FIU population is able to access the vaccine, has there been conversation about providing the vaccine to FIU family members as well? The family members of FIU staff, personnel, and others?
We are, well, currently, as you know, we have the limited doses, the limited number of vaccines. So what we're doing is we're working very judiciously to be able to, first and foremost, abide and comply with the governor's executive order. And once we know that we have covered all those groups that is in compliance with the order, and if there's something else, absolutely, we would be opening it to the rest of our family in alignment with the executive order, which means if there's anyone else that could be 65 or over that would be able to be a recipient of the vaccine. I also want to expand that we don't know when, but also probably in the coming weeks. And I don't know if my colleagues, maybe Dr. Trepka knows a bit more, or even Dr. Espinal, but also these vaccines will be readily available on commercial sites such as CVS and Walgreens. Again, it is just a matter, that would be the commercial aspect of the distribution point, but we hope that in the coming weeks, probably at February, March, we will know more. In the meantime, we do have tools in our box that we need to use. So follow our preventive measures and test frequently.
So
Yes.
I can add to that last point. Remember I said, how do we get transmission? We get an infectious person in contact with a susceptible person. Well, you can vaccinate that susceptible person. The other thing you do is prevent the infectious person from getting in contact with susceptible people. And that's all about doing the P3 app and staying off campus when you don't feel well, wearing your mask, getting tested, staying 6 feet apart. These are all really doing the same things in the sense that we're trying to break the chain of transmission and keep the levels of coronavirus low to minimize the hospitalizations and the deaths.
So one other question, just to continue to follow up on this topic. If I am an individual that already had contracted COVID-19, I have built an immunity, right, based on the information that you have shared. Should I get the vaccine or not? And how would that work?
May I
Okay.
answer that?
So first and foremost, if you have had the disease, we know that that immunity would last approximately 90 to 120 days. And after that, of course, just because you had the COVID disease does not prevent you from having your vaccine as well. Right now, what we're saying is we may want to wait 90 days, but we need to know whether you're immune or not. Therefore, we may need to test you for an antibody, knowingly that you had a positive RT-PCR, and that antibody test then would be very specific to the fact that it is an antibody to SARS-2, but it does not prevent you from not having the vaccine.
Great, thank you very much for that response. I'm gonna turn over to Dr. Espinal, and this is actually a very interesting question, right? In the last week or so, there's been a tremendous amount of attention being given to Israel and their ability to distribute and give that vaccine to a large percentage of their population. Outside of a smaller population that they're working with, is there anything that Israel is doing that we should be or we're not doing yet?
Well, that's a very important question. Israel has been a model in vaccination, not only in the COVID-19 as it is today, but in the regular vaccination program, achieving a large and higher, very high vaccination coverage for each one of the vaccines that has been implemented in the national program. So this is not new for them. But specifically about COVID, they have first a very strong political commitment to the vaccination plan, not only to the purchasing of the vaccines. And this is what we lack in many, many countries today, a political will to really and live by example in front of the community. This is why the Israeli community really believes and trusts the government initiatives and more their vaccination program. Second, they did have a very important communication plan in advance of the vaccine implementation to reduce precisely this lack of confidence in the vaccination program. Third, as a very important, they were able to implement rapidly a multi-sites vaccination, multi-vaccination sites in order to facilitate the access of the community to the vaccine, COVID-19 vaccine. And these are the most relevant problems or I mean, advantages that have been seen in the vaccination program in Israel. It's really a good example for the rest of the world to achieve 21% of vaccination coverage today, at least with first dose. But this is not new for them again. They really have a very strong history in the vaccination program.
So clearly, right, there's a great deal of logistics that takes place, right, to be able to administer the number of vaccines that have to be administered on a global scale. And we're seeing some of those challenges, obviously, here locally as well. And speaking specifically to some of these local challenges that we are seeing reports now of individuals that have received their first vaccine, and there seems to be some confusion as to whether there will be availability for the second dosage of the vaccine, how they can schedule that appointment, what they should be doing. And we do know that there are 3 entities, right, that are the ones that are administering. I'm gonna open this up to the panel. Can we talk a little bit about what those differences are and what someone should be expecting if they have already received the first vaccine, the first dose? Dr.
Yes.
Muldan?
Yes, of course. One of the things that I have had conversations with the Department of Health is the fact that we were receiving this a lot, or this amount of vaccine, and how can we be sure that we will receive the second vaccine? One of the things that they have said is that because this has a registration of Florida shots, and they know that we need to complete the cycle of the 2 doses, that those that receive the first dose should be and will be receiving that second dose. At this point, that's the best that we can do right now, but I don't want in any way that anyone that is lined up to receive this first dose will back down simply because they may think that they may not be receiving the second dose. That is not what we want. We want every dose in every arm as soon as possible.
Very good. Dr. Trepka, did you want to add anything to that?
So the CDC has issued guidance about the second dose, and if it's late, what do you do? So they're very strict about the timing of the second dose with respect to it not being too early. Too early is potentially might decrease the efficacy of the vaccine. They do say that if the vaccine is delivered too late, the second dose, you don't need to repeat it. That you'll just be considered complete. Now that's typical of how vaccinations are done in general. So if you get the second dose late, well, you won't be have the level of immunity as fast as a person who gets it exactly on time, but it does not negate the efficacy of the first dose at all. But I understand people's frustrations with kind of the whole process, but there has been a commitment to give 2 doses to everybody who is vaccinated.
And how does that scheduling or logistical challenge, how is that being handled at FIU now that we've opened a vaccination site?
Again, this has been conversations with the Department of Health, and they know that these 2,000 doses came to our closed pot. And so we have Moderna, by the way, the one that we are administering is Moderna. So we hope that actually in the next 3 to 4 weeks that we will get the second 2,000 dose. So there was also a confusion that in receiving these 2,000 doses or vaccine, whether we would just vaccinate 1,000 and wait on the other 1,000. That is not the case. Right now, like as I stated, we want every dose in every arm. So once we close and finish the cycle, possibly by the end of next week, we hope then that in the next 4 weeks, we will be receiving the second dose, which will be another 2,000 vaccines for the individuals that have been vaccinated at this point.
Thank you, Dr. Roldan. Let me just make a statement that we know that this town hall was scheduled to end at 3:30, but in light of all of the questions that we have and we're trying to answer as we speak, we're going to extend our time just a little bit here. So we thank you all for staying tuned and participating, and of course to our panelists. So speaking of the vaccines, we have heard. Go ahead, Dr. Spinato.
Just one additional comment. I mean, it's very important to stick with the schedule that is already recommended. But WHO issued just a couple of days ago the global recommendation for the COVID-19 vaccines, specifically the Pfizer vaccine. And the expert committee says that if there is any programmatic, but real programmatic situation that needs to delay the second dose, that second dose could be delayed up to 6 weeks, but no more than that. But again, I mean, this is absolutely under a very high crisis in terms of vaccine supply. But there is this range of 19 to 42 days after the first dose, if there is a need to delay due to a programmatic critical issue. And you can see the recommendation at the WHO website on the COVID-19 vaccination.
So there have been reports recently of various strains of these, of the mutations, right, of the COVID-19, and some various strains that have come out. Are these vaccines designed to protect us against these variants, or are we looking now to have to get another vaccine?
At today, there has been some testing with the Pfizer and the Moderna vaccine, and they cross protect to these new variants. But it's very important what I'm going to say. There is a recent publication, and this is in the laboratory conditions. And the laboratory conditions, after 7 passages in cells of the wild virus in contact with the neutralizing antibodies coming from a patient, immune patient, the virus was able to change all the peak structure of the spike protein and escape the neutralizing capacity of those serums out of immune patients. So there is always the potential that we have this variant. This is why we need really to improve the vaccine implementation rapidly in order to avoid the high pressure of the immune system and the antibodies on the potential variants of the SARS-CoV-2 virus. So it's a really dangerous situation. We don't really get our 75% of herd immunity rapidly.
Thank you very much. I'm going to ask a question on behalf of the students, right? I consider myself young at heart, so I'm trying to ask this question through their lens. But if I'm a student listening to this conversation today, my thought is, well, by the time they get to my age group in the distribution of the vaccines, and the fact that there's a very low percentage of the younger population that is seriously affected by this disease, should I even get the vaccine? If I'm a 22-year-old, should I get the vaccine? Why should I get the vaccine? Is there a message that we want to send to our students so that they have as much information as possible regarding where we stand and what we would like from them? Anyone? Dr. Roldan?
The short answer is yes, you get the vaccine as it's readily available. And in the meantime, you have to be champions to prevention and to screening. So that's the best that we can tell them right now, because they can be of great help to be able to reduce and mitigate transmission in our community. So as soon as it's readily available, they should be able to get vaccinated.
And if I can also just emphasize, a face covering is a very effective medical device, and we'll all be wearing face coverings even after we get the vaccination. So as we see, hopefully, there may be guidelines coming in next week. President Biden may have some different directives and so forth. But I just want to emphasize that that is your best medical device until you get the shot on the arm, is wearing your face covering wherever you go.
And if I can add too, even though young people are much less likely to die of COVID-19 or be hospitalized for it, some young people have died of COVID-19 and have been hospitalized. And some have had chronic health conditions as a result of the COVID-19 infection. So personally, there still are very good reasons, even if you are young, to be vaccinated. The second thing is, right now, we cannot vaccinate children because the vaccine has not been tested in children. It's being tested in, I think, 12 to 18-year-olds now. And so maybe that group might be able to be vaccinated, say, in the fall. But even young children, we don't have any data on. In public health, we talk about cocooning. That is protecting the people that we are around. So by getting vaccinated, you are helping to protect those people whom you are close to, whether in your household or your close family members. So in this case, if you're a parent or a grandparent and you get vaccinated, you're helping to protect your children who cannot get vaccinated because they're too young to get vaccinated. You may also be protecting the older people, possibly if for some reason they're unable to get vaccinated because of severe allergies or something like that. So with vaccination, there's a benefit to you personally, and there's also a very great benefit to the people around you and the general community. And so that's why it's really important, and I'm very glad that so many people are interested in learning about the COVID-19 vaccines.
And go ahead, Dr. Espinal, go ahead.
One addition, just to remember that the COVID-19 vaccination program has 2 important goals. First, in people 65 plus and with health conditions at any age, the vaccine will prevent the severity of clinical cases, mortality, and hospitalization. But in the young people, healthy young people, that remember that this is the large group where the virus keep the transmission in the community mostly because they become asymptomatic into a very large extent. The vaccine will prevent the transmission to others. And in fact, Indonesia started a very, very interesting program 2 days ago, vaccinating not the at-risk group and the 65 and plus, just vaccinating the healthy individuals in order to prevent transmission to the population. We remains to be seen the impact, but this is a very interesting concept. So young people need to understand, and our students, that they are the ones that keep the transmission in the community because they become asymptomatic, and this is the way the transmission keeps going and the virus keep going, going around our community and the people and infect the 65 and plus and cause all the clinical severe cases and death and hospitalization.
So I want to thank the panelists for your comments, and I was very glad that we were able to give some information and advice to our students. And again, that statement and the information can't be stated enough. I mean, students, you can adhere to all of the health guidelines that we have in place here at the university, but when you step away from the campus, if you are engaging as what we've seen on the television, large groups gathering on the beach or at places, at these events that could potentially become super spreader events, really, unfortunately, you can really become part of the problem. And it's not about how this could impact you or your health, but it really is about protecting those that are around you, as Dr. Espinal just said. So I want to reiterate that, and I think that's very important. So we have run over time. I'm very happy to see we've answered quite a bit of the questions. A lot of the questions were related in many ways, but I think we've gotten through all of the major themes of the questions that were being asked. I do want to remind everyone that this meeting has been recorded, and we will be posting that, as well as all of the questions and answers that we have worked very hard to answer throughout this Zoom chat, and we'll make that available on our website. Again, we're going to be posting those sites. Our repopulation site is posted right now on the chat screen, and you can visit our website and look for it as well. So we want to thank you again, the panelists, for taking part, for all of our support group that was here as well, answering the questions. And with that, I want to take it and kick it back over to our provost, Dr. Kenneth Thurton, for some closing remarks.
Thank you, Pablo. And I just want to close by, again, thanking everyone for joining us. This is not the end of the conversation. It's really the beginning of the conversation. And as you have additional questions and suggestions, please share them with us. And we will have updates in the coming weeks as more information comes to us. And I just want to reinforce the fact that we're doing everything in our power to ensure that we have a safe setting on campus for the faculty and the students and the staff supporting the faculty and students, and that we will continue to do that. And it is very exciting. The current vaccines that we have, more vaccines will be coming out. We also need to exercise some patience, and I know it's frustrating, but eventually your number will come up, but keep wearing your face covering and keep following the practices that you've learned over the last 10 months, and we'll all get through this. And just thank you. I look forward to seeing you soon. We have a short video now, I think, that we're going to show.
Yes.